All right, it is time for you to be well with 360 Wellness. Fatigue, irritability, insomnia, anxiety, they're all signs that can mean something could be potentially going wrong with your thyroid.
Yeah, your symptoms and hormones are not usually addressed in the typical medical community. Well, here to tell you what the doctor forgot to mention is Dr. Mark Albers. Welcome back. I've been looking forward to having you on the show.
Yes.
I love following up with all this because I learned so much. Hormones, big deal when it comes, especially when you're going back to the gym and trying to lose weight.
Right. So about February, after people start their New Year's resolutions, they start dropping out about February. Why is that? Because they're not seeing the results, and it's not because it's because they're not. It's not all about the calories. It's about hormones. So today we're going to talk about the thyroid.
Okay.
The thyroid is one of your glands that has to deal with weight loss. A lot of women have thyroid symptoms, and maybe they go to the doctor, and the doctor may do the test for that, but then they find out the test comes back normal. Well, there's 9 tests that we do where the typical medical doctor will only do 1. Why is that? It's because it's not covered by insurance. They call it not medically necessary, right? Well, if you have cold hands, cold feet, overweight, depression, all these different symptoms, then would you consider it medically necessary?
I would, yes.
Absolutely.
Sure.
So that's what we do.
Sure.
And we show you how we do that, get around that in one of our dinner talks. We have those once a week. So if we go to the graphic here on the thyroid.
Sure.
These are the symptoms. Well, there's the graphic right there. So
sure.
93% of what the thyroid produces is T4.
Wow.
7% is T3. And what we need to know is the T3 is the usable hormone. So the T4 has to be converted over to the T3. And where that occurs at is the small intestine, the liver, and the adrenal. So if we have problems or dysfunction with those different organ systems, then we'll have problems converting the T4 to the T3.
Mm-hmm.
So that's what we look at. We look at all these different things that the medical community a lot of times won't completely address. And so we look at those when we're looking at functional medicine, and that's what we do.
And then you see the hidden dysfunction of the liver, small intestines, or adrenal glands can block the conversion of T4 and T3. Mark, let me ask you this one. When you sit me down or sit somebody down, how quick is that check? How quick when you sit a patient down can they go through this procedure to find out if they're a big candidate for this?
Well, one of the tests that we do is a saliva test to check the hormones. And so that's the most accurate way to check your hormones, which is why a lot of times the medical community won't check your hormones accurately because it's not covered by insurance. Okay, so but we do that, but it takes about 2-3 weeks to get those tests back.
Okay.
But in the meantime, typically in the first 2 to 4 weeks, we'll see anywhere from 9 to 12 pound weight loss in a particular program that we're doing.
Wow.
Even before we get the lab test back. So we're already starting into it on day 1.
That is absolutely great. 360 Wellness, we want to remind you again, Mark is getting a great response off this. If you could do it, boy, you have any questions about it, there you see the phone number, 316-686-2626. I know you've got these dinners coming up. You want to RSVP for that at Lakeside, correct, Mark?
Lakeside?
Yep, and that's certainly something you can do too at 686-2626. As we said, they're located at 350 North Rock Road. Great to see you again.
Yeah.
Good to see you guys.
Great topic.
Great
Fantastic.
information.
Yeah, all right.
Well, now that the holidays are